two things. I will talk about this in one second, but just wanted to add maybe to that previous point of discussion one element more. It is not just a doctor's issue here. The mental health professionals are not just medically trained and educated people. We still have APA, American Psychological Association, that regroups the interests and houses the professional interests of clinical psychologists. In the world of employee assistance, which a lot of enterprises in the United States do employ, the largest majority of the counselors working there are educated clinical social workers. All of these people do have experience and an education, and often much more than the doctors in their formal training procedures, in really understanding and knowing more about behavioral health and mental health type issues. And when they have a therapeutic education, then they are also more equipped indeed to deal with people confronting ailments as were described. Now, when we come to the point of wellness versus treatment of illness, we are really exactly at that same crossroad. The wellness component, or we often talk also more about the well-being, the mental well-being of an individual, has a bit of a preventative component in the sense that there are all sorts of things that people can be educated in doing in a better way to maintain a certain balance in their life and whatever. When we talk about mental illness, we are really talking about people who are in a process of disease, and who do have needs of proper treatment. And indeed, I would certainly concede to what Kavi was saying. There we very often do need people who have a background in psychiatry, who are medically trained in that field, and who can potentially, as needed, prescribe appropriate forms of medication as do exist. But that's not the solution to the majority of people. The very largest number of people, even confronting what we call mental illness, do need other forms of treatment and can be helped in all sorts of different ways. And when we come to discuss a bit more about the technologies that are out there, I'm sure that we will see that there is a lot in the pipeline at the moment that can help to emphasize exactly this particular point. So let's see how we look at that. And maybe one more point, mental illness is really defined very much by the DSM-5, for those who like technology, the Diagnostic and Statistical Manual that has been drafted in various versions. We are now at version 5 by the American Psychiatric Association. And that is the Bible, the nosology that enlists all the different forms of mental illnesses that people can encounter. And gives guidelines for treatment approaches, diagnostic, differentiation, and whatever. So that's maybe also important to have in the back of our minds when we discuss this.